It's Dr. Chris here. This is another story of why your doctor is lying to you and how. This week I had two patients completely unrelated, and this is what makes my work very challenging and rewarding, but really, really frustrating because I look at how the medical system treats people. One patient had come in to have muscle work done, dry needling done on his ITB, that's a muscle on the side of the leg. Well, it's a iliotibial band. So it's a kind of a fiber, for lack of a better word. Anyway, he's had problems with it for years since he had a knee injury. He comes in, his intake form is filled out with a whole bunch of other stuff dealing with a chronic pain condition beyond that he's suffering from. And I look at his intake, I start going over it, and he's like, I'm not here for any of that. I'm here for this leg. His physical therapist had him rolling out with a foam roller the ITB. That's an absolutely horrendous idea. It only causes pain and more trauma, in my experience. Most physical therapy advises against it. You feel like you're doing something because it hurts like hell. Guess what? You're not. So he's rolling it out and causing pain. He has already seen functional medicine doctors who basically, and I've been trained in functional medicine. Some of them are very good. Most of them are trying, but in the end, the training is here's how to sell a lot of supplements and get people to spend a fortune on testing and supplements. And I feel like the outcomes are limited. So I don't really apply it, but I do understand it. Um, and I worked on him and I explained I'm going to be doing the antagonist muscles. So if the ITB is pulling outward, I'm doing muscles on the inside of the leg. And most importantly, I'm doing a lot of hip muscles because most of the pain in the ITB refers down from the hip. We don't need to go that far into technicals. Long of the short, he was very pleased with the treatment and he had better knee mobility. His ITB felt a lot better, etc. Felt great. And we're talking at the end, and lately I've been really consumed with sleep and dreams. Dreams are absolutely fascinating because the subconscious can communicate with consciousness through the imagery of dreams. So it's an amazing avenue. So he tells me I've been having nightmares every night, vivid nightmares for years, and I talked to my therapist about it. And I look up, he's doing low dose naltrexone. Now I don't know much about it. I know, some stuff about why people take it. I don't need to know this. I don't prescribe it. It's not within my scope of practice. But I do look it up because I care. And I look it up, and guess what? Side effects include, because I looked up LDN nightmares. That is a known side effect. Now, how this man can be taking medication, literally flagging a side effect to his professionals that he's paying lots of money to see. I know that functional is not covered, trying to do everything right, and they're failing him in every respect. And this guy's working hard. We have to empower ourselves for our own healthcare, and we have to find doctors that go above and beyond because otherwise, you get standard care, you get bad results on a good day from a lot of it. Um, Yesterday, so that this will be later in the week, I saw another patient. He has pancreatitis. And he says the doctors are telling him because pancreatitis is inflammation of the pancreas. His pancreas is not able to make very many digestive enzymes, and so he has to take supplemental enzymes for his food to get broken down. His doctors said basically, yeah, guess what? You're doing this for life. You're not going to get better. Pretty banner way to deal with a human being. So I looked up he's on two medications for blood pressure. I look up the medications and pancreatitis. One of them actually protects for it. The other one can cause it. Again, he's seeing these specialists, people who do only this for a living, and they don't bother to look into if it can be causing a problem. It took me less than a minute to do this for him. And it was a red flag. And I said, hey, buddy, um, you may want to speak with your prescribing physician about this potential side effect and see if there's another medication you can take to get the same result without the same risk profile. So this is, I don't mean to beat up on doctors, but, and I actually know some that are awesome, awesome professionals, great people, and really care and go that extra mile to communicate with the patient because it really is communication in the end. But goodness gracious, I am appalled with what we call medical care. It is the dead opposite for so many people. It's friggin' tragic. So make sure you're empowered with your own health. and make sure you find doctors who care. Be good.